Okay, is it going now?
Yes, it is.
Okay, hi. My name is John Gross. This is on January the 12th, 2019, and this is my 69th birthday. Um, I'm applying for funds on the GoFundMe network because I need, extensive dental work. Um, I have this Flexite cover that covers my upper teeth that are really screwed up if I take it out of shave. Now I look like the Great Pumpkin. So anyhow, I'll go ahead and try and give you an overview of the situation. But this enabled me to at least make a presentable appearance to get some part-time work so I could survive. I'm currently living in Section 8 housing here on the South End Street in Baltimore. And I really don't have the resources to even contend with these dental problems, and I'm going to explain them to you. So anyhow,
Why don't you put that back in?
I will do that. Thank you.
Yeah.
This is pretty unseemly, is it not?
No, it just helps you speak better.
Okay, so I won't go. Okay, so anyhow, I have been dealing with in recent years the wholesale disintegration and aging of extensive dental work, of old dental work, leaving behind multiple roots that require surgical extraction, broken crowns necessitating the extraction of the teeth so affected by abscess and facial cellulitis, a frontal bridge that requires partial repair or replacement, and the extraction of a broken root tip at the foundation of a lower frontal bridge. I have received a thorough dental examination at the Johns Hopkins Dental Clinic and have been told that the dental work which I need to have done will cost, this is approximate, I can get an exact figure, cost around $5,000, and that the completion of this work will take place over 5 visits, and that the cost of each visit will need to be defrayed in full at the time of each visit. Dealing with these dental problems is urgently needed, for chewing has become impossible and painful. The root tips left behind by broken teeth will develop abscesses and will inevitably require painful and expensive emergency treatment in the future, which I will not be able to pay for. In August of this year, of last year now, 2018, I was stricken with facial cellulitis caused by an abscess, the result of a fractured crown on a rear molar, which required immediate medical attention. I went to the emergency room at Johns Hopkins Hospital, where I received an IV drip to combat the infection and spent the night in the hospital under observation. I was prescribed a 10-day antibiotic regimen along with pain medication for palliative relief. The cracked molar was extracted several weeks later after finishing this antibiotic regimen, and after 2 subsequent dental evaluations and noting the results of these examinations, there's no doubt that further episodes of dental abscess will follow, necessitating emergency procedures. As I said before, I won't be able to pay for. Currently, I have Medicare insurance, which provides significant coverage for physician visits and hospitalizations, but this plan does not pay for dental work. I need specifically extraction of root tips, repair of a broken bridge, repair of broken foundations, and the attendant root tip extractions involved in the repair and replacement of this bridge, or the dentures with which I will need to be fitted in the aftermath of this work.
And it doesn't help that the government is shut down.
Well, no, that goes without saying. But anyhow, after the turn of the new year, I will consult with my dentist and find out the total cost of these procedures. If you would like to contact or meet me at any time, I will find a way to provide contact information for that purpose. Any financial help that you can provide would be greatly appreciated. This is going to require, the amount of dental work that's required is pretty involved. The 2 dentists at Hopkins, looked at a whole series of, full mouth x-rays, and looked at it, and they debated about, well, we can do this, we can do that, we can do this, we can do that. But the upshot of the matter is that there are going to be a large number of extractions, most of which will be surgical, and surgical extractions are much more expensive than regular extractions. They're usually like 2 or 3 times as costly. And I want to get this done. For the obvious reason that it's difficult for me to eat, to chew, and because I see that down the road, and not very far down the road, there are going to be fires to be put out that I'm not going to be able to contend with. So I hope that I've given you some insight into what's going on here, and I hope you can give me some assistance. All right. Thank you very much.